Hello everyone. My name is Kevin from Center of Balance. We are a group of acupuncturists and Chinese medicine doctors from Dinsdale, Hamilton. Our clinic is called Center of Balance. So today I'm going to do a live talk, a live discussion on the topic of wrist pain. So firstly, we'll have a look at the diagnosis and causes for wrist pain in Western medicine, and then we're going to talk about the theories of Chinese medicine and causes in Chinese medicine. Okay, let us start. So what is wrist pain? So wrist pain can be classified as any discomfort felt in the wrist. It can be caused by a variety of issues, including acute injury, arthritis, gout, carpal tunnel syndrome. Even though the wrist is a small part of the body, it's comprised of 8 bones, as well as ligaments and tendons. Making it somewhat delicate area. So the causes of wrist pain. The following conditions are common causes of wrist pain. So firstly, you have carpal tunnel syndrome. The median nerve is one of the 3 major nerves in the forearm. Carpal tunnel syndrome occurs when the median nerve becomes compressed or pinched. It's located on the palm side of your hand, providing sensation to the following parts of the hand: thumb, index finger, middle finger, part of the ring finger. The median nerve also provides the electrical impulse to the muscle leading to the thumb. Carpal tunnel syndrome can occur in one or both of tingling on the side of your hand near the thumb. So the risk factor for carpal tunnel syndromes include performing repetitive tasks with your hands, such as typing, drawing, or sewing, pregnancy, having certain medical conditions such as diabetes, arthritis, or underactive thyroid, having a family history of carpal tunnel, as anatomic differences can run in families. Then you have wrist injury, and an injury to your wrist can also cause pain. Falling and catching yourself with your hands is a common way to injure the area. Swelling, bruising, or disfigured joints near the wrist may be symptoms of fracture, tendonitis, tendon, or ligament tear. It's also possible that the nerves or the tissue around the wrist can become injured, even if the bone is unharmed. Next, you have gout. Gout is a type of inflammatory arthritis that is typically caused by buildup of uric acid. Uric acid is a chemical produced when your body breaks down food that contains organic compounds called purines. So most uric acid is dissolved in the blood and removed from the body through urination. However, in some cases, the body produces too much uric acid, and in other cases, the body does not excrete uric acid sufficiently. The excess uric acid can be deposited in the joints, resulting in pain and swelling. Gout pain frequently occurs in the knee, ankle, wrist, and feet. So the common risk factors for gout include overconsuming alcohol, overconsuming foods and drinks that's high in fructose, eating a diet high in purine-rich food like red meat and certain types of seafood, living with obesity, certain medications such as diuretics, other conditions such as high blood pressure, diabetes, and kidney disease. The next cause is arthritis. So arthritis is an inflammation of the joint. The condition can cause swelling and stiffness in the affected body part. Arthritis has many causes, including normal wear and tear, aging, and overworking the hands. There are many forms of arthritis, but the most common types that can affect the wrist include: number 1, it develops when the immune system mistakenly attacks the lining of your joints, including your wrist. This can cause painful swelling, which may eventually result in bone erosion. And the second one is osteoarthritis. It's a degenerative joint disease that's common among older adults. It is caused by a breakdown of the cartilage that covers the joint. The protective tissue is damaged and repeated during the aging process or over time and repeated motion. This increases the friction as the bones of the joint rub against each other, resulting in swelling and pain. While arthritis can happen to anyone, especially people who are with older age, there are some risk factors that can increase your chances of developing it. According to the Center of Disease Control and Prevention, these factors include living with obesity, living with untreated infections, smoking, untreated joint injuries due to overuse, such as knee bending. The next one you have, the next cause for wrist pain is ganglion cysts. These benign, non-cancerous, and usually harmless lumps occur most often in the hands, usually on the back of the wrist. It's not known what causes ganglion cysts, but according to the American Academy of orthopedic surgeons, they tend to appear most often in people who are aged between 15 to 40, gymnasts because the repeat stress to the wrist, individual assigned female at birth. Okay. Many times ganglion cysts are painless, but if they are putting pressure on a joint or nerve, they can cause pain in the wrist area. Treatment for ganglion cyst varies from waiting to see if it will go away on its own, to wearing a splint, to draining it. Then you have what's called a cane box disease. It's a rare form of disease that causes the lunate bone in the wrist to slowly break down due to low blood supply. Cane box disease can cause wrist pain, swelling, decreased grip strength. It is not known what causes this disease, and symptoms can range from mild to more severe. The condition can be treated with medication, splinting. So what are some of the symptoms of wrist pain? Depending on what causes your wrist pain, it may be accompanied by the following symptoms. Swollen fingers, difficulty making a fist or gripping object, numbness or tingling sensation in the hands, pain, numbness or tingling that gets worse at night, sudden sharp pain in the hand, swelling or redness around the wrist, warmth in a wrist joint. So what are some of the treatments for wrist pain? Treatment options for wrist pain can vary depending on the cause. So for example, carpal tunnel syndrome, there's a fly around me, includes wearing a wrist brace or a splint to reduce swelling and ease wrist pain, applying a hot cold compress for 10 to 20 minutes at a time, taking anti-inflammatory or pain-relieving medications such as ibuprofen or naproxen, steroid injections, physical therapy, having surgery to repair the median nerve in severe cases. For gouts, it may consist of taking anti-inflammatory medication, drinking lots of water, cutting back on high-fat foods and alcohol, taking medication as your doctor prescribed to decrease uric acid in your blood, in your body, Treatment for ganglion cysts can include wearing a splint to keep the wrist from moving, aspiration during draining, which means draining the cyst, surgically removing the cyst. Kinbox disease is typically treated by keeping the wrist immobile, taking pain medication, surgery to restore blood flow to the wrist, surgery to even out the length of arm bones. If you have any sustained wrist injury, you can help promote healing by wearing a wrist splint, resting your wrist and keeping it elevated, taking a mild pain reliever such as ibuprofen or acetaminophen, placing an ice pack on the affected area for several minutes at a time to reduce swelling and pain. If you have arthritis, consider visiting a physical therapist. A physical therapist can show you that how to strengthen and stretch exercises that can help your wrist. Okay. So for diagnosis of wrist pain using Western methods, including X-ray or bending a wrist doing physical tests, such as bending a wrist for 60 seconds, see if numbness or tingling develops. Tap the area over the median nerve to see if pain occurs, testing the strength of your wrist and fingers. X-ray, as I mentioned before, requesting a nerve conduction velocity test to check if the nerve, to check for nerve damage. Order urine and blood tests to detect if underlying medical conditions, and requesting a small sample of fluid to be taken from your joints to check for cysts, crystals or calcium. So above, what I talked about was the Western theory on wrist pain and diagnosis and treatment method according to Western medicine. So let's have a look at how Chinese medicine looks at wrist pain. So wrist pain often consists of pain, swollenness, or throbbing sensation, or around the wrist, the pain starts. So these are some common symptoms for wrist pain. So oftentimes it occurs in people who like mothers who has to carry baby frequently, or cooks who has to repeatedly chop using knives, or furniture movers. They often experience these type of wrist pains. And oftentimes the pain can radiate towards the thumb or the index finger. Okay, and so things including gripping a cup, or holding a cell phone, or turning a bottle cap will all trigger pain symptom. Okay, such as sharp pain in the wrist. So for females, the occurrence of wrist pain is 5 times higher than male patients. So this is the reason why we also call it mama's hen. Okay. Okay, so according to the modern medicine, or the mainstream medicine, this type of disease is very hard to heal, and very high occurrence rate, reoccurrence rate, and especially in weathers such as coldness, when the climate becomes very cold. So in Chinese medicine's perspective, any pain in the body, it's all associated with your meridian system, like we talked about in other videos. So when you have experienced any type of pain syndrome, we always try to refer to the meridians. So in the hands, how many meridians are in the hands? You have the outer side, and then you have the inner side of the arm. Okay? So the outer side of the arm is what we call yang, the yang side, which is the visible or the exterior side. The inside is what we call the internal or the inner side. Okay, so you have the yang and yin. So on the yang hand, yang part side, you have 3 meridians. They're called the yang meridians. And on the inside, you have 3 meridians called the yin meridians. So when we have pain in the wrist, the first thing the Chinese medicine doctor will ask, oh, where is the pain exactly? Can you please pinpoint with one finger? Okay, pinpoint with one finger. Is it in the inside, or is it on the outside? Okay. So for example, if the wrist pain is more located around the outside, close to the thumb area, this is where the large intestine channel runs. So we can think, okay, so maybe it's got to do with large intestine channel. Or if it's got to do with sort of on the inner side, close to the thumb, then we think, okay, this is where the lung meridian runs. So this is the way we think. So the lung meridian and the large intestine meridian, many kind of pain often occurs in this area, on the lung meridian and on the large intestine meridian. And causing the thumb to hurt. Okay. So, sorry, I'm just reading my notes at the moment. So what is the and also Chinese medicine also talks about when these type of pain on the lung meridian and on the large intestine meridian occur. It is really to do with seasons as well. So especially in the winter and in the springtime, in the winter and springtime, the temperature is the lowest, and this is when the symptoms occurs most frequently. All right. This is because when the environment's temperature drops, our body also tends to become colder and cooler. And when that happens, our energy also decreases. We have to, so if you think like this, and during the winter we need to sleep more, we need to eat more because we require more energy to function because the weather is colder. We have to have more energy to fend off the cold and keep ourselves warm. So it is during the winter and spring season, the temperature is lowest, and because the energy is insufficient, we are not warm enough, and therefore these two meridians tend to play up. Okay, so when it plays up, there's pain. So they are often, apart from the wrist pain is often accompanied by other types of pain syndromes, such as neck and shoulder pain, chest pain, or fever, coughs, asthma, or hard breathing, dizziness, stifling the chest, runny nose, or itchy nose, diarrhea, or itchy skin. So these are all indications of, so if you spend the night out in the cold, for example partying, or you got caught in the rain, and you didn't manage yourself to warm yourself up and the coldness got into your body, so it's often one of the causes for wrist pain as well. So how do we treat wrist pain? So to treat wrist pain, there are two ways of thinking about the strategy. So one is to needle on the sick meridians itself. For example, if you have wrist pain over here on the lung and large intestine meridian, then I would take the other hand to treat this hand. If this is the sick hand, I will use this hand and needle along this hand or in the painful area to treat this hand. And this actually works a wonder. It's magical. Okay, it works really, really well. The other way of thinking about it is to think which meridians corresponds with lung and large intestine. So the answer is there are two meridians that actually corresponds with these two meridians. Okay, then these are spleen meridian and stomach meridian on the foot. Okay, and so we can also look at needling on the spleen meridian, which runs along the outside of the toe all the way up the body, and stomach meridian, which is this green line here, which runs from the center of the foot all the way up past the knee and up the body as well. So we can treat on these two meridians instead of treating the arm. So oftentimes you see Chinese medicine, we don't actually treat the problem area. The problem area occurs there, but we often look elsewhere to get treatment. You might think this is really, really strange, but it works clinically from what I've seen, and many of my colleagues, they also experience it really works. If we say, for example, the wrist pain is here and we treat this hand or we treat the feet, the corresponding meridian, the stomach and the spleen, it really, really helps reducing the symptom. So this is quite different from the Western. I have to find the cause here. So I take an X-ray. So let's see if we can find any deformities or abnormalities in the wrist. But Chinese medicine is totally different. So oftentimes, as I said before, the pain in your body is often resulted from evil external elements from the environment invading your body. For example, dampness, coldness, or even heat invading your body can cause these problems. So our job as acupuncturists and herbalists is to get these evils out, or to help the body balance itself. So one of the techniques we do is called organ balancing needling. So because you think, oh, well, organs are inside, right? And my wrist pain, what does that have anything to do with my wrist? The organs, what does that have anything to do with that? Well, the answer is the organs are all connected to the external parts. For example, your arm, your head, your legs, everything. Because the stomach, for example, is connected to your muscles. Think like this. Say, for example, if your stomach and spleen is not functioning well, and then you eat food. If it's not functioning well, it doesn't digest well, it cannot break down the food efficiently for your body to absorb. So, like I said, the spleen and stomach connects to your muscle, right? So, if your stomach and spleen does not break down food into fine enough consistency, your body cannot absorb it. So, after training or after you do some exercise, you're trying to grow some muscles, the muscle won't grow well because it doesn't receive the nutrients or the energy that it needs from the food, right? So the external and internal connection between the organs and the other parts of the body. So so we like I said before, one of the techniques we do is to balance the pose, to balance the organ functions. And that works wonder as well, in really helping our patients to achieving a longer lasting result in their pain management or one other techniques we do is we look at the structure balance. So I talked about the organ balance, but the structural balance is also very important. Say, for example, if somebody has a structural imbalance, for example, this arm is much higher than the other arm. Okay, so if this arm is higher, then your posture is lopsided. One side's higher, and that causes compression on this side, right, on your right side. So if your organs are compressed, they don't function as well as they do normally. So, and if the organs don't function well, then it's connected to your tissues, tissues such as tendons, ligaments, muscles, and all the other parts. So they're all connected. So we look at using a technique to help release your muscles so it becomes relatively more balanced. So again, from what I've seen and what my colleagues have seen, is the structure balance also is really effective in helping pain relief. Okay, so these are two of the techniques that we do. So apart from that, we also encourage our patients to give themselves a massage. For example, we teach them, so for example, if your wrist hits here, then you just do some massage on the other side in the same location. So you do that 2 or 3 times a week, 2 or 3 times a day, and then you put some wheat bag or some heat on it to on either side of the wrist to help manage the pain. And that often works hand in hand with our treatment, and it really helps improve our patients' problems much quicker. So if you're on the channel, if not, you can contact us on 07846 7956. That's 07846 7956. And that's Central Balance based in Dinsdale, Hamilton. And I look forward to hearing from you and maybe see you in the clinic sometimes. Or you're also welcome to tell your friends and family if they need help to come to us. We're more than happy to help. Thank you for watching. My name is Kevin. I'll see you next time. Bye.